Justin, thank you for joining us.
Thank you for having me.
Your recent article, How Surveillance Technology Powered South Korea's COVID-19 Response, covers an interesting aspect of South Korea's approach in managing the virus. Tell us about South Korea's success in suppressing the virus.
So I think it's important to say, the numbers don't lie. And when you're looking at the global landscape of how different countries have responded differently to the virus, I think at this point it's pretty clear that South Korea is one of the countries that's done very well. And if we're, for instance, comparing to Australia, South Korea was one of the first countries outside of China to be exposed to the virus. They also have twice the population that Australia does and a staggering 160 times higher population density. So when you're just looking at those three characteristics, you would expect South Korea to have a lot more cases than Australia, but unfortunately, that's not actually what you see. In fact, over the last few days, Australia has now surpassed South Korea in total confirmed cases. So that should point to the idea that maybe South Korea is doing something pretty well. And those things that they're doing well are they have a very organized and very well thought out strategy for how to do testing, contact tracing, and quarantine. And more importantly, they have these three things kind of linked together so that the testing results immediately inform the contact tracing, and that those tracing results can immediately inform additional testing as well as additional quarantine.
It's interesting, you mentioned Australia, same with the US and other Western, such as England and parts of Europe, all having a terrible time with COVID-19. Yet you look at South Korea, Singapore, Hong Kong, they seem to be a lot more organised. Probably they're more concerned about less about, I would imagine, their civil liberties, because we can't use an app, we can use one, they'll know where we're going, we can't do that. Is this part of the reason why South Korea, Hong Kong, Taiwan, all those countries seem to be doing better than the US, Australia, New Zealand, and so on?
I do think that there are some strong cultural effects that are at play. So, for instance, in South Korea and most East Asian countries, actually, the social structure is built in such a way so that most people don't want to harm other people, and there's a certain aspect of shame and guilt that's associated with that. So there's definitely a pretty strong cultural component. But in addition to this, there are also some infrastructural and some political aspects that also need to be considered. So, for instance, the countries that you named, especially Taiwan and South Korea, they had had some prior experiences with smaller epidemics, most notably MERS, which really gave them the opportunity to kind of work through some of the weaknesses of their protocols, which is a luxury that a lot of Western countries really just haven't had. And so that's also a really important aspect, I think, of developing a very powerful and well thought out infectious disease protocol.
Interesting. The other attitude would be, it's not going to happen to us. Where the US or England or Australia, New Zealand, it will happen to everybody else in Asia, and you were much more prepared. But you would think, though, that we had that data at our fingertips, that we could have implemented something much faster than we have.
Right. So even it's important to note that before COVID-19, most countries technically on paper, they do have procedures that are written down in a book somewhere. But it's a big leap from having a procedure written down to actually being able to use that procedure and put it into action. And so especially in the MERS epidemic that Korea experienced, that was one of the moments where they actually got to try out their procedures. And they did learn some important lessons from that experience. So the first thing that they learned was that they actually didn't have adequate infrastructure to bring testing up to par, to have a large amount of tests created very quickly. And so following the MERS episode, one of the things that the government here did was they very quickly established that infrastructure and improved their connections with a lot of biotechnology companies so they could draw on those connections later if a larger epidemic happened, which is exactly what happened in COVID-19. But the second thing that happened too, which was kind of unexpected, was that the public really expressed a strong desire to be informed about what was happening. And so the first MERS case patient who came into Korea came in from overseas and was hospitalized at a facility in Seoul. And for quite a while, the central government didn't release any information, even anonymized information about what was going on. And what ended up happening was one of the doctors who was attending to this patient himself got infected, and he actually went around, visited a lot of different public events, including one event with over 1,500 people. And so this generated a lot of public outrage. And so eventually what happened was the municipal city government stepped in and did their own contact tracing procedures to get ahead of the virus and to contain it, which is probably one of the reasons why Korea had a very low death rate from MERS. And so after that experience as well, there was a lot learned about the importance of information and what the public expectations are for that information. And so one of the real powerful things that resulted from that was this anonymized use of information. So for instance, if a newly diagnosed patient appears in my city of Busan here today, within 24 hours, I'll receive a text message about that patient and where they've been in the last week or so. And that information is very helpful because it informs me about whether I may have inadvertently come in contact with that person or visited some of the places that that person visited. And it allows me to make good decisions about whether maybe I should be tested or put into quarantine.
Interesting. Again, the cultural differences come to play there. If that happened in the US, there will be an outcry of my privacy has been broadcast around the world, whereas in Korea or South Korea and Taiwan and those places, it's entirely different. And this probably is one of the reasons why the West, they're having a real problem with it.
Yeah, I do think so, but there's also a legality aspect too that needs to be considered. So the way that Korea empowers their public health officials to have access to various types of surveillance information is they have essentially created a law that allows public health officials in a pandemic or epidemic situation to repurpose the access to that information that law enforcement authorities would normally enjoy. So there are very types of information that law enforcement authorities have been using to track down criminals, to catch money launderers, catch tax evaders, and so forth. So some of those pieces of information are credit card transaction logs. So if you're a newly diagnosed patient today, within 10 minutes, public health officials can know, where you spent your money in the last week. And this tells you which buses you took, which subway you took, where you had coffee, where you went to dinner. And so that's kind of the beginning of how the contact tracing procedures are started. And so that kind of information, even 10 years ago, was already available for law enforcement authorities. But the laws more or less just allow those same protocols to be repurposed by public health officials. And that law, fortunately for Koreans, was put in place before the COVID-19 pandemic, whereas in a lot of other countries, even though they might have the laws specific for law enforcement, they don't have the law that allows public health authorities to repurpose those same procedures. And I'm guessing a lot of political authorities in most Western countries probably have already made the decision that the cultural barriers are too great to try to push that kind of law through their Congress or their assembly at this time, which, I think is unfortunate because I think that dialogue does need to start happening, because without that kind of centralized approach to contact tracing, you're really not going to be able to contain the virus very well.
Tell me about businesses. Did you have many shutdowns?
Korea has never gone through any, large-scale shutdown. I think the largest scale we went through was when the city of Daegu was in the middle of the height of its pandemic, and for like a week, most things were shut down. But even there, it wasn't a complete shutdown. For businesses, there were also some targeted shutdowns. So, for instance, night establishments like nightclubs and bars and karaoke bars, some of these were shut down for short periods of time in a targeted manner in certain locations where they were having some of these outbreaks or clusters. But by and large, most businesses were completely left alone. Department stores stayed open, restaurants stayed open. Now, that doesn't mean there wasn't any economic damage, though, because especially when the epidemic was at its height, many people stayed at home, so there were revenue losses, but there was really no large-scale shutdown.
Surveillance, another hot topic throughout US, Australia, blah, 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 but very necessary. Tell us about your surveillance in your country.
Right. So as I mentioned earlier, one of the types of information that's used for contact tracing surveillance purposes are these credit card transaction records. And again, those are available within 10 minutes because all credit card companies in South Korea starting a decade ago were required to automatically store all their transaction logs onto government servers. Now, that doesn't mean the government can just look at them anytime they want. They do have to have a reason to go do it. So that's either a law enforcement trigger or a public health trigger. The second type of information that they have access to are the mobile phone location logs. So whenever you turn your phone on and it connects to your service provider automatically creates a log of all the transmission towers your phone has connected to. And so, when you're in a certain geographical area, there are many towers around you, and to give you the best signal possible, the system will want to connect you with the tower that's closest to you. And this information, it doesn't pinpoint your location, but does give you some basic idea of what neighborhood you might have been in. And so this information can be used in conjunction with the credit card transaction logs to give you a basic idea of, did this person actually stay at home when they said they were going to stay at home? Were they actually at this coffee shop that was in this department store? But that's really already a very good starting place to go deeper, dig deeper, and to find more detailed information. And that detailed information usually comes through the third type of information, which is the CCTV surveillance camera footage. So Korea has a pretty high density of cameras. Most of them are used for catching traffic violators and parking violators, so they're usually on the street. But a lot of establishments also independently have them. So coffee shops, department stores will have them. And so the law is already written in such a way that when you have a new confirmed patient, there is a public health trigger. They can send police officers to the establishments where you had these credit card transactions to collect surveillance footage at the time when those transactions occurred. And this gives you very detailed information about what time did the person actually come into the establishment, what time did they leave, were they with other people, who sat near them when they left, did they get into their own car, did they take a bus, were they wearing a mask most of the time. And so this gives public health authorities a lot of power in deciding who in those environments, the other contexts, how much risk they may have been under.
Was the tracing and tracking made possible by these measures a major factor in the country's success in suppressing COVID-19?
Oh, absolutely. And so there are 3 steps in the process, right? There's the testing, there's the contact tracing, and then there's the quarantine and additional testing. And all 3 of these steps, if you have just one of them in isolation, the system doesn't work very well. The power really happens when you have all 3 coupled together, so that the first test informs the contact tracing, and then the contact tracing informs the next round of tests and the next set of quarantines. And you use this process in kind of, an onion-shaped pattern of outward testing and contact tracing to try to get ahead of the spread of the virus and to contain it. That's literally what you're doing. You're trying to contain the virus.
In Australia, they had an app called COVID Safe, which was a voluntary, free of course, voluntary, but it just didn't work. Do you think government initiatives that this is going to happen, and whether you like it or not, because it's going to help the economy still tick over, save people's lives, is better than the voluntary apps and approach?
So the voluntary apps have a lot of problems. Now, I would like to say that having some app is probably better than having no app, but the difference is probably marginal. And it'll depend a lot on how many people are using it, and most importantly, what's the reliability of the information that's being put into the app. Because a lot of these third-party apps that I've seen, I haven't seen the Australian one, but I've seen the one in the UK, and a lot of these apps, they depend on self-reports. So even though the locational information may be automatic because you turn on Bluetooth or GPS, reporting whether or not you've had symptoms or whether you've tested positive or negative, that information depends, as far as I know, solely on the users. And that creates a lot of reliability issues, because someone who has a cough today might think it's allergies when in fact, they're sick, or someone who's been diagnosed as positive may be reluctant to report that on the app because they're afraid of something else happening that, they want to avoid. And then you always have those small population of people who are just, interested in having fun and mucking up the system by reporting that they've tested positive, even though they haven't. So the centralized government-oriented approach is kind of essential for really having reliable information, because the most reliable information is the official diagnosis that you receive. And there's nothing that's going to be more reliable than that. So if for the input of the app, you can rely on those official diagnoses, that will really make the app, at least the input part of it, reliable. But then you also have trouble with the output part. So once people have been informed, okay, you were a contact of someone who was diagnosed yesterday, what are they actually going to do with that information? And here, a lot of, especially in the US, one of the problems that we've seen, two of the problems that we've seen. One is that the initial messaging about how to handle and deal with the pandemic was very mixed. And so you already have a lot of people who are convinced that, this is a liberal or left-wing conspiracy and that the media is lying to them and so forth. And so even if you give them the right information, they probably won't act upon it in the right way. And then you also have this issue of some people who, and we've seen this in Korea as well, who depend on hourly income. So even though they know they might need to get quarantined, they might have other economic reasons why they can't. And so creating some kind of a protocol and some kind of a structure for them to safely take some time off while they're getting tested, those kinds of procedures are things too that even in Korea, we're going to have to develop a little more as we move forward.
What about masks? I mean, there was our chief medical health officer said, no, we don't need a mask. And then they're saying, well, perhaps we do. Victoria now has made it, in Australia, has made it mandatory that they wear masks. Yet other states are saying, no, don't need a mask. What are your views? Because you're one of the experts in this.
So Korea, because they have such a strong, well-organized contact tracing system that's been in place for a while, the data is very reliable because it's very unlikely that we've been missing a lot of confirmed cases. And so this really tells you about the dynamics about how the virus normally spreads. And so the example I like to use is the Itaewon Club incident in May, in which one individual visited 5 clubs over the span of about a 12-hour period, coming into contact with about 1,700 people. And as a result of that one person, over the course of 8 weeks, about 300 people became infected. And these were not direct contacts usually. So these were secondary, tertiary, and so forth contacts, people who were infected by the people who were infected by the people who were infected by the people who were infected by this person. And so, the virus does spread out quite far. But when you just consider that for a second, that a single person can infect up to 300 people in the span of 8 weeks in the country with the most organized contact tracing procedures, that's kind of startling already. And so, even having small holes in your protocols is a bad thing. Now, where the masks come in and where Korean data is also very informative is, of all the cases we've had in Korea so far, about 90% of them have been either family members, friends, or work colleagues of the first diagnosed patient. So it seems like sharing a confined environment for moderate to long periods of time, that is really the main mode of transmission. And then the remaining 10% have been a mixture of other kinds of environments like weddings or funerals and things like this. And so when you're thinking about how the virus spreads, it really is about the infected individual kind of marking their territory with virus, shedding virus in a location, in an environment, and then other people picking that virus up. And so even though the mask might not protect you that much as an uninfected individual, it is absolutely essential to prevent and to prohibit the spread of virus if you are an infected individual. And so the hard part here is, even though people might think they know whether they're infected or not, the truth is they don't. And so they should be wearing masks, not so much to protect themselves, but really to protect other people.
A cure on the horizon or not? We all live in hope. So this is your moment to give us some hope.
Okay, so if you already have the virus, there are a couple drugs now that seem to be hopeful for reducing the symptoms, for reducing the time that you spend with severe symptoms in the hospital. So far, we haven't seen any magic bullets. So probably cures once you're in the hospital with severe symptoms. The cures, I don't know if you can call them that, but the treatments that you'll get will probably be combinations of 2 or 3 drugs moving forward. That's probably what we're going to see. So it's still better not to get sick. Now, having said that, I do want to mention that there's a lot of evidence now that people who do get sick but recover seem to get organ damage at a fairly alarming rate. So these are things like, kidney damage, intestinal damage. Mr. Quest from BBC, actually, he put out a very good article explaining how he seemed to have lost his eye-hand coordination. And there are a lot of accounts like this. So it seems like the virus can do what appears to be permanent damage to a lot of different organ systems. So you really don't want to get the virus if you don't have to. So what's probably going to happen first is we're going to get vaccines. And vaccines are preventative. probably there are going to be a lot of different vaccines that come out, and probably the vaccines that each person is going to have access to first is going to be the one that their country makes first, because, that's just politically the right way to do it. And there are unfortunately still a lot of questions that need to be worked out once a vaccine is ready. So for instance, who's going to get it first? What's the order? What criteria are you going to use? How much is going to cost? And so there are a lot of questions yet that still haven't been worked out on a central government level about what's going to happen once the vaccine is being produced in large enough quantities. But for the moment, the fight is to try to create the vaccine in large enough quantities. So inventing a vaccine isn't that difficult, actually, but having it in large enough quantities to administer to the whole world, that's actually the challenge.
People were saying that COVID-19, it's just like the flu, it'll come and go. Wow. It's nothing like that, is it?
It's nothing like the flu. I mean, the death rate is at least 20 to 30 times higher. Even the way that it spreads, it actually seems to spread a little bit better than a lot of cold and flu viruses too. But the thing that's really scary about this virus is it doesn't affect everybody in the same way. So, if you got it and the death rate was 80%, then it wouldn't spread as much because everyone who got it would probably die very quickly. I don't mean that in any facetious or lighthearted manner. That's just, the pure hard logical science of how it works. But because this virus not only can give people severe symptoms, but it can also hide very well, especially in younger and healthier individuals, it spreads really well, even without symptoms being noticed. So it really is a really bad virus. It's
a perfect terrorist, isn't it?
It really is. And, I'm really disheartened that a lot of countries still are not having that organized dialogue about, on a federal level, what can we do to save lives? Because we're literally having hundreds, sometimes thousands of people die every day. And, I understand privacy concerns, and believe me, I've written articles about the importance of privacy and my ownership of my anonymized data. But the data that's being used in Korea for contact tracing, number one, it's already collected by companies throughout the world. I mean, your service provider already has logs of which towers your phone connected to. And, transaction logs are also used by most countries to catch tax evasion and, monetary fraud and things like this. So it's really just an issue of repurposing existing laws for this pandemic situation. But there isn't even any dialogue about it. And that is really, I think, dangerous.
I might just nip into the scotch a bit earlier. Justin,
sorry.
Thank you very much. If I don't ever speak to you again, you know that I've just gone to the other side too. Look, thank you very much for your time, and we must do this more often. You speak a lot of sense, and your country is one country that is tackling this head on and making some inroads. Thank you very much.
Thank you for having me.
And that's it for BNAP today, July 29, 2020. Be safe and be kind. I'm Mike Ryan.